If my hand ended like this, that'd be bicep. If my hand ends like this, it's more tricep. They got like a face full of boob. They're like, look at my tricep and your boob just eclipses.
Warning! You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
Have you had your pre-workout yet, Karina?
No.
Okay, well, try some Fenris Fury.
I hate you. This is terrible. Not the Fenris Fury. The Fenris Fury is great.
Just my acting?
Your acting's terrible.
My acting's terrible. Acting human is difficult for me. Cyberdyne didn't program me.
So the first time I did 2 scoops, which is 11 grams of citrulline, which I don't need for somebody my size.
She's got a man's heart and a man's personality, but a woman's body weight. So she always goes for the manly doses.
I'm gonna do one and 1/8 scoop, and then I'll do my intro.
1 1/8 scoop, because you're 112 pounds?
Yeah.
Okay.
No, I'm way bigger than that.
I know, that's why I thought it was funny that you did that.
That would be awful.
I think it'll be fine. There's nothing wrong with a 112-pound woman who's 5 foot tall, but...
Frost giant something.
Frost giant's ball sweat? What
is the name of it? It's yours.
It's Frost... Oh, yeah, it's Frost giant's blood.
Frost giant's blood.
Because Frost giant's ball sweat didn't test well.
It didn't test well?
No.
In the focus groups?
And then this is what, Jotun's blood? Yeah.
Jotun's blood.
Yep, which is ironic because a Jotun is a frost giant.
How many,
but I know that no one knows that.
I was going to say, how many people do you think have no idea how to pronounce that?
Probably 99% of people.
Jotun.
That they can't figure out how to use a needle, that they can't figure out how to pronounce J's in other languages. So first thing
do I have to finish that first, or?
Warm up cardio, because my legs are old.
Okay. What does that entail?
I usually do the elliptical.
For how long?
5 minutes.
Oh, good. He says cardio, but it's really just moving your body through space.
When you're 220 pounds, moving through space is cardio.
I'm not coordinated enough for this, remember?
That's why we're on film.
Oh, I'm gonna fall.
That's the best part about you, is you're perfect at everything except for moving through space.
Except literally moving. I just spilled my pre-workout.
Down your top?
Well, no, just like everywhere.
All right, I'll catch you.
Okay, we're just gonna...
Well, watch your shins. All right.
I know, that's what's gonna happen. Do I need my intro?
Yeah, we probably should do intros. Good point.
Okay.
I'll go get my...
Okay, so hold on, wait. 2 scoops, 20 crabs, carbs.
20 crabs.
How many do I need?
First of all, let's do the size chart correctly. So you're 100 pounds.
There's a size chart.
There's 100 pounds.
I haven't turned it over. Okay, so 1.5.
So we're doing an hour and a half at 100 pounds?
I'm not 100 pounds.
What are you, 150?
Well, I'm in between that, like 135.
Are you counting fat mass?
Should I just count?
Yeah.
So like 110?
Yeah. What's this? What
is that how much I'm doing?
I don't know. 1.5? I'm not looking at the size chart.
All right.
I do 5 scoops.
Jesus, 5 scoops?
Yeah, because I'm over 200 pounds and I'm doing
You're
it for...
250 and you do it for 2 hours?
Yeah. I don't actually use 5 scoops. I just want her to think I'm big and strong.
Do you want more salt?
Sure.
Or are you good?
Can't have too big of a pump. Thank you. That looks awesome.
What are we doing?
Assisted pull-ups.
Okay, let's see how bad this hurts.
You want me to examine your shoulder first?
No, it's been feeling better. Which grip did you do? This one?
I did that one.
What are you trying to target?
Lats, lower lats.
Oh, wow, okay.
Do you want to go up higher? Harder contraction?
Yeah.
When you stretch it out, does it hurt more than when you come down 80% of the way?
Yep.
Okay.
That's why I wasn't coming down all the way.
That's what I figured.
What's your rep range for this?
I try to do mostly 12s on everything. Unless it's lower body or arms, I try to go like 15, 20. Do you feel that all the way down in here?
Yep.
Okay. Because I know you wanted upper lats. I was going to say if you're getting too much lower lats.
No, that's 100% upper lats.
Okay.
Upper lats.
Because this is what I would use for upper lats. This is for both lats. This is lower lats and brachialis, and I use that for biceps.
I don't have the mobility right now, but that grip that we were just doing, I feel right here. What do you want it on?
I'm going to do -70 for my first work set.
Come on. Nice.
There's 11 plus 1. Yep. Here we're doing 2 sets on 4 exercises for back. What'd you get, 15 reps?
Yeah. There you go.
Was that 10 plus 1 or 11?
10. Nope.
Good shit. So we're done here. This is a little bit of finagling to
Okay.
hit it just right, but you can really get your lats good if you don't do what the engineers want you to do. So you see how I'm not sitting in this correctly? There you go. That's my whole lat. From top to bottom, out to in. Good. It's a deceptively hard machine.
Yeah.
The one plate is not easy on this thing when you keep your pad down. You know how everyone rows where their chest comes off the
Yeah,
pad?
that looked heavy.
Yeah.
So butt back, right?
Yeah. Good.
Okay.
Now you might hurt your bicep tendon if you do too much abduction, external rotation. Try to stretch it out more. There you go. Oh, that's perfect. Oh, right there. There you go.
Right there? Yep. Good. Come on. Good set.
It was fucking triceps at the end.
Was it?
The lats gave up. People are like, why the triceps? If my hand ended like this, that'd be bicep. If my hand ends like this, it's more tricep. They got like a face full of boob. They're like, look at my tricep and your boob just eclipses.
That's precisely what just happened. Well, I must have a perfectly good tricep shot.
No, you made it better. They'd rather look at your boobs than my face anyway. Those look good as fuck. Come on, give me 2 more. Give me 2 more.
Oh yeah, the last one was triceps.
Do you guys have good contraction at the end because it lightens up? So if right here is where we're getting most of our work done, right? And then here it's almost weightless.
Yeah.
Because we're getting half the load here that we do here.
Yeah.
So I really can get a really good contraction. It wraps all the way around to the spine, and I get the lumbar and the thoracic origin contraction off this machine and only this machine.
This is like one of the few machines that I get a really good stretch at the end.
Right. Kai does not.
And if you do it
So we have to put a
on the
yoga block.
inhale, his arms are too long.
Because this isn't
We've got
adjustable.
T-Rex arms.
Yeah, we got T-Rex arms. But this isn't adjustable. Every other machine on the world is going to be adjustable. Wait, do your Velociraptor.
No.
Do your Velociraptor.
No.
It's the best.
It'll come out at some point. But if you inhale, then you can create maximum space
Stretch.
for your lats to wrap around.
So inhale on the eccentric.
Yeah.
So you, and then,
Yep.
and you keep your head back.
Yeah.
Like a football.
Yeah.
Helmet. Nobody else does that. They always go like this.
Oh.
Or they go like this. They go like this or like that. But you actually do this.
I don't think I can do. What's the second one?
This.
Why is that?
Everyone does that. They go,
Who's doing that?
like they want to drown in the rain. My dad used to say, like, turkeys are so stupid they drown in the rain.
You have to be a T-Rex. This
was
is a
like,
T-Rex
what?
machine. Short people are advantaged with this machine.
This tank top you're wearing.
Yeah?
For some reason, I thought it was a Savage Squad tank top.
Oh no, you'll
But it's-
hate what it is.
But it's Machine Gun Kelly.
Yeah.
Because I saw MGK on the back.
Back in the day,
I don't hate Machine Gun Kelly. I'm jealous of him because I have a thing for Megan Fox.
this was a back in the day MGK before he got into like
Pop.
music.
He did everything at some point.
Yeah, this was like rap rock era.
That's got to be the before the credits. Is you doing, you doing
All right.
the Velociraptor.
Let's get serious. Come on. 2 more. Good. Oh, you got more. You got more.
All right, we're
No,
down
it's
here.
been good.
That's what she says.
Okay. Oh. Nice.
Oh, right there.
I love that. When you connect with the movement just right. Feels so good. It's the best feeling.
I don't think they know what you're talking about.
It's the best.
I think you should make it more clear.
I should have done more weight to warm up. This feels great though.
Doesn't it?
Oh my God, this feels good.
It gets me right there where it's hard to reach.
Yeah.
And then I can even, if I tilt my body away, I can even get in more. A lot of people lean over. I like to offset like this. I'm coming slightly across my body. For you, I would switch to crossing over.
Yeah.
Because you'll get more of a
More of my
wrap.
up, yeah.
And less down.
I'll try that next time.
All right.
I have really low lat insertions, so if I grow my lower lats even more, it'll make my waist wider.
I know you told me about that. Oh.
Okay, so now I'm, oh, okay, oh yeah.
You can feel that wrap all the way in
Yeah,
there.
that's great.
Does that hit better than the last set?
Yeah, that's great. You didn't do a work set, right?
I know I did not.
We're just warming up.
Mm-hmm. Oh. Oh. There you go. Oh. There you go, thank you. Ah. Ah. Ah.
Nice. Good set.
Was the amplitude
Good
decreasing over time?
No.
So this is about as deep as I can get and feel my lats, Karina. And I feel like I'm cheating.
Oh, no,
If I do this,
yeah.
it's all rear
Then
delts.
It's all rear delts, yeah.
Okay. Kai flatters me. He says it's because your lats are so big and your triceps are so big they touch. But I don't know if he's just,
yeah.
because he's my friend, he's telling me what I want to hear. Hopefully you can edit out my breathing, because I'm breathing heavier than you, just being fat than you are breathing doing the set.
All I can hear is your breathing.
Oh.
Then all I could focus on was your breathing after you said that. I couldn't hear it before. Oh, oh, that's good.
The music is so slow. It takes all the energy out of my sets.
So I was at the gym yesterday, and the playlist was Nickelback,
Oh,
Morgan Wallen,
so stripper music.
Nickelback, stripper music. What are you talking about?
Every stripper I've ever met like Nickelback.
What?
Yeah.
I feel like Nickelback is like
Oh, wait.
sad, like daytime drinking music.
And you don't think that would define a stripper as a sad day drinker?
Okay, wait.
They're exuberant as
I thought you were
fuck.
talking about like the strippers dancing. to
No, I
music.
don't go to strip clubs. They just find me.
They find Todd in the wild.
Yeah, I'm Captain Save-A-Ho.
They're like the Velociraptor.
Nope.
Nope.
There we go.
There. Good. Right there. Come on, control it. Control it. Good.
Oh, I heard it that time.
Yep.
Your shoulder's like, fuck you, bitch.
My
We're
shoulder
going home.
hates me. My shoulder's like, what is this nonsense?
It just went like, I'm done. And it just popped out. And it's like, I quit.
Damn. It doesn't hurt though. It's just loud and crunchy
It's inflamed.
and poppy, yeah.
We gotta bring its inflammation down.
Well,
So that's
this won't help.
No, that's why I was injecting after every upper body workout. TB500, GHKCU, and BPC 157 right in the
Directly
sheath.
into the...
Right into the sheath.
That hurts like a motherfucker.
Well, rather than looking for the tendon, I look for the groove. I'd shoot it into the groove, and then I'd put the tendon back in the groove.
Oh, that's interesting.
Yeah.
That's an approach.
Yeah, then it would fill the whole sheath.
That sounds horrifically painful.
Yeah, it hurts worse when you put the injection in because the inflammation from the injection it adds to it, but the medicine hasn't kicked in yet. But by the third day, you're good. God, it's so busy in here today.
What? There's like one person.
Was that my third set? I think I fucked up. Did we do 2 sets or 3 sets?
Fuck, I don't know.
We did too many sets.
I don't know. I don't know.
Now we have to even it out though. It's the Texas Chainsaw Massacre rule. Do you remember the remake of Texas Chainsaw Massacre where he loses his leg? And he's like, oh, well, you're uneven. We got to even it up. And he chainsaws off his other leg so that he had a matching set of stumps. Dude, I never could reconcile that one.
I'm not sure about that.
I was like, I don't understand the logic to this at all.
Where are we going to?
T-bar.
All right. Here we are.
My favorite T-bar.
Yeah, it's a great T-bar.
My favorite T-bar.
My favorite T-bar.
My favorite T-bar. What happens if you stretch it out all the way?
I'm scared for my tendon.
Oh, okay. That makes sense. I always hurt myself on this one too. It's so funny that you know exactly how to avoid re-injuring yourself, and I just go, fuck it. I'll just shoot it later. Nothing's scarier than when somebody's asking for instructions on how to inject their tendons, and then they say, what needle should I use? It's like, oh, yeah. If you don't know.
The biggest one that you can find.
I was like, you don't have enough intelligence to do this. Nothing's a dumber question than what needle should I use? They're like, I have to hit the muscle with this. What size needle? It's like long enough to reach the muscle, fucktard. I don't know how much fat you have.
I like it when you ask somebody what the dosage is and they say 1 drop. What does that mean?
You mean 1 cc?
No, 1 drop.
I love that they don't know that you have to multiply a volume by a concentration to get a mass.
It's too complicated for...
How did you get through high school? And it's like, I don't understand this. Do you want me to put a 25 on for you? Okay. You should. Okay, I don't see a whole lot of contraction with the rhomboids that I'm seeing with the lats.
Yeah.
You are initiating your lats and your rhomboids at the same time, but we're not getting a full contraction, so, because you can't stretch them out, you can't feel them, I think is the problem.
Yeah.
Because normally what I do is I'd stretch out and turtle my back, so I can really feel my rhomboids, then retract my scapula.
Touch my... Okay, let go. Yeah, I'm hitting them.
Okay.
Got it? Good. Nice. Nice. Come on. Good.
Was that 9 plus 1 or 10?
That was 10.
That was 10.
Yeah. You can see
So the
your-
last one looked as good as the first one?
Yeah.
Okay.
It looked good. You can see your rhomboids pumped through your shirt.
Okay.
I'm just gonna put this right on here.
I'll feel the stretch right there, and then contract. Good. You initiated with the rhomboids that time.
All right. Come on. Nice. Nice. Oh. 9. What, delts?
No, we're doing incline dumbbells.
And then what?
Then it's gonna be a delt machine.
Okay. You use straps for this?
Yeah, because the dumbbells are so heavy.
Okay.
If I drop them, I lose a toe or a kneecap.
I don't need that.
Yeah, you do. You have a hard time. You said that the limiting factor is getting the dumbbells in a position, right?
Possibly.
So with the straps, it makes it easier. This is one of my hacks. Holy shit.
What?
I found this. This has been missing for like a year and a half.
That looks scary.
I like scary.
No, that looks like that's gonna break. You're gonna tear something. That's gonna break any second. Look at that. Look at that.
All right, let's try to tear it.
That no,
Sure.
but
I only
you're
use
gonna
these
tear
for
that.
I only use these for dumbbells.
Look at these. These are so not torn and not frayed at all. X and sledge. I don't want to smell that.
I know that's my point. Is this?
Nobody wants to smell
It's
that.
the most white trash thing about me is how old my equipment is and ratty it is.
Wait, what are we doing? What are we doing?
Is this 3 dumbbells?
That looks scary.
I would bring your elbows in a little. There you go. That's gonna be safer.
Okay. Yep.
And not that completely out to the side is inappropriate, but you immediately start drifting behind you,
Yeah.
which
'Cause
is
it's
totally
not-
going to
'cause it's
push it out of the
unstable.
socket.
Yep.
Yeah.
All right. That was a work set.
It was 9.
Do you wrap your thumb?
On these I do, fuck yeah.
He said. On these. I said,
Especially if I was trying to get my anterior delt.
yeah.
Fuck yeah.
Wrap them thumbs. Bitches.
And you're targeting anterior delt, correct? Mm-hmm. Okay. And you're biasing your triceps over destruction of your rotator cuff, right?
Yeah.
All right. So the reason why I say those things is because her hand was inside her elbow. So that protects the rotator cuff, but it also will help develop the tricep. And when your arm's all the way back like this, it's gonna be more middle delt. When you bring it in here, it's more anterior delt.
Well, usually I do it to
Right.
bias my middle though.
Right, but it's gonna pop
Yeah.
your rotator cuff out of the socket. And then if you come down below parallel, you can hit your chest, but not if you're out here. If you come out here and come down below parallel, you're gonna tear your rotator cuff. So you gotta, if you're gonna bring it down below parallel, you gotta bring your arm in a little bit. It's like this, 30 degrees, in the scapular plane. Scapular plane.
And then you stick your thumbs out and do a little bit of this. This is the angle. All right. Lock it. Nice. Indeed. Those look good.
I felt a lot of long head of the tricep. When I keep my elbow,
Yeah.
where I can feel my tricep touch my lat,
Yeah.
I got a lot of long head and a lot of upper pec. If I angle out a little bit, I feel a lot of elbow, anterior delt. If I come up here, I can feel sternal head of my pec.
Yeah. Your elbows are cracking a lot. Is that typical?
It's the right elbow. I'm nursing it back to health.
Did you have tendonitis or what?
I do right now, yeah, but it's getting better. It was from doing my skull crusher giant set.
Those hit the triceps like none other, but my God, they give you tendonitis really bad.
Yeah. So you gotta rotate them in for a month and then rotate them back out again. It's the only way to do them. Ghost touch, I'm not doing shit. Okay. Did you feel your bicep tendon was more protected though?
Yeah.
Okay. I think that was 12.
Mm-hmm. Indeed. Yeah.
That felt so much better than the 110s. Did it look better than the 110s or look the same?
The 110s actually looked better.
Okay, good.
Yeah.
Then I'm not wrong for going that heavy then.
No.
Okay. Did you get more middle belt that time?
Yeah.
Okay.
I went light and slow.
Nope. All right, I'm gonna go a little lower. There you go. It's funny you're going lower with the affected shoulder.
Help me. How do you position yourself in this here machine?
All right, so I push. First of all, I'd raise my seat up to a 3 for you.
What?
I don't think so. Because I'm at 5. So I would go up to at least a 4 or 3 for you.
Okay. I'm gonna fall. All right.
Now,
Okay.
stick your arms out, internally rotate them slightly, and then lift. Feeling that right here? Mm-hmm. Are you feeling any pain through here?
No.
All right. Can you go higher? Did that hurt?
No.
Okay. Good. And your spine was neutral, your head was back. A lot of people, they collapse their spine when they do this.
Okay. They just won't grow. That was still a warm-up, yeah?
Yep.
Okay. What did I have it at? I had it at
Oh, you had it 30, so you can go 40.
40. All right.
Before I do my work set, I have to check my old work set because I just reincorporated these.
Cool. You go for high reps on this?
I do 20 for shoulders, otherwise I'll hurt myself. Because I was doing 20 on 130, and that's how I got hurt, so. Are you on 50?
Nope.
Okay. Okay. Okay, come on, give me 3 more.
When I fail, will you help me get the last few reps?
Slow down the eccentric a little bit. Chest up. There you go. Unless that hurts your rotator cuff. Here we go. I got you. Keep it up. Let the negative do the job. One more. Let the negative do its job. Good.
Nice set.
Thank you.
Good set.
We got one more. I do 4 on middle delts. 4 sets of delts 3 times a week. I usually do 3 sets of rear delts afterward. I don't normally do them today, but I will if you want to. Bear, I barely touched my instra. Oh no, I put water in this, that's right. Okay, give me 2 more. Heads up. One more. Did I hurt you with my left hand?
No.
Okay, cool.
I increased the weight on that one.
Oh, to 50?
So that's why it was harder. Whew. Whew. Now I feel so light. I like how after lateral, your arms kind of like, they float up.
So the cue that I liked when I was growing up was you go into a door jam, you push your back of your hands against the door jam and you push as hard as you can, really hard.
Yeah.
And then when you walk out, your arms will float up.
Yeah.
And that's how you know you activated your middle delts. Then you can go start doing your middle delt sets. That's what I used to do like in high school. Last set. You're at 50?
Yep.
That was a good set.
I'm flying. All right, that was our last set.
That was our last.
Not on Ratatouille.
All right, so this is too high. So here, watch this, check this out.
Yeah.
If my thumb's outside of this, I feel rear delts and teres.
Yeah.
If I feel my thumb inside this and I externally rotate, I feel middle delt.
Okay.
And rear delt. Notice that it's at an angle. I'm not doing it straight out. I'm gonna move this down a little bit.
You feel medial and rear?
Because I already have the pump in the medial.
Okay.
I can protract my scapula and get more rear.
I've been there since last summer, so I don't really know how. You did it this summer?
Ooh.
So you're out there, which you might get some middle back involvement. Counterintuitively, the closer you go to your body, it might actually get more rear delt. Without it cueing, without lats jumping in. It doesn't make sense, but it works that way. So like if I wanted to hit lats, I'd be like this. That's lats.
Yeah, but you're going
But if
out.
I'm coming out at this
coming
angle,
out.
I'm not hitting lats anymore. It's all reared out. Yeah.
Core, yeah.
I saw the upper trap kicking in a little bit.
Yes, those things.
You still feeling reared out?
I got more, yeah.
So did you want to see at my leg extension style?
Yeah.
Okay.
Ooh, I just hit quads yesterday, so these are gonna feel spicy.
So look, see how I'm angled in here?
You do.
And then I internally rotate as I come up.
You do single legs?
Always, if I can. If I try to do double leg. The amount of internal rotation is so much force.
Yeah.
It's really uncomfortable.
That.
On my foot,
Yeah.
I'm trying to pronate
But
it.
as you're lifting out. You're not actually lifting out, but you're cueing out.
Laterally?
Yeah.
No.
You sure?
Maybe I am, huh? Yeah, a little bit.
Yeah.
And then the other leg.
What an interesting way to mount that machine.
Yeah.
Like a horse.
I focus on mounting. Mounting and dismounting.
Like a horse.
So it's almost like you're,
This is a really interesting approach. And because you're leaned back, you get full stretch.
I get it all up in here too.
Yeah.
Because if you'll look, the sweep starts up here.
Yeah.
It doesn't start down there. The upper sweep is what makes your waist look small, not the lower sweep.
You're telling the camera, not me, right?
Yeah.
Okay. Where do you think that the sweep starts? All right. So, oh God, I'm sore. Okay. So we're here.
It makes it even easier.
Internally
If you're worried
rotate.
about your butt coming up, grab the handle with your right
like
hand. But if you're not, I put it behind the machine. There.
Right here?
Yeah.
Okay, so
So we got this angle kicking. Let's shift the hips over a little bit. There you go. But I don't keep it internally rotated the whole time. I straighten it at the bottom. Then I turn it into it.
got it. Okay. So
There.
I feel it. It originates here, comes down here, and through there.
Right. Now, if you're losing it when you come down with it, the eccentric,
Yeah.
because your butt's coming up, grab the handle with that hand.
Nope. Got it. Okay. Oh yeah. Okay. Got it. Yep.
Try the other leg.
Oh, I can't get out of here. Oh God. All right. How'd you do this? All right. So we're gonna come in here. We're gonna. Oh.
Yep.
Look at that.
Yep.
All
Yep.
right.
Yep.
Look at that.
Looking like a pro.
All right. Oh, that's even better. That leg is great. All right, let's square up. There we go.
Boom. See, this is straighter. Yeah.
Oh, I feel that. Oh, yep. Oh, that's so good. That's so good. Oh, yeah, that's great. I have this machine at my gym.
The Life Fitness.
Yeah. No, this is hammer strength.
This, I mean, oh yeah, but it's also a Life Fitness.
Is it?
Yeah, Arthur Jones' dad,
Oh,
Arthur
yeah,
Jones'
okay.
son owns both companies.
Oh, watch me hurt myself getting out of this now. All right, here we go. Oh, okay. Fuck me.
Rotate. What are you doing? What? Oh man.
That's how we tear
The
ourselves.
the grace of Karina.
Did you just call me Christina? Thanks,
So-
bud.
Thank you. So here they got the white there. I go like one, so I'm hip width right there. I go one line up from that. So here, now I've got mounted pinky, thumb, or big toe, and then heel. I'm gonna come out a little bit so my toe lines up with my knee and my heel. I'm going to internally rotate the femurs and push out. And I don't have to come all the way down.
Right. Well, you can't go all the way down. Oh, your knees are crunchy.
If I come down to here, it's quads. If I come to here, it's actually touching. My heels come up and it's glutes.
Yeah. Well, I go all the way down because I want glutes and quads. You're good.
Right.
I think he had it on that one. Yeah. Thank you.
Oh, thanks, buddy.
So I go full depth because I want glutes
Right.
and quads. So I get the quads on the first half of the movement and then the glutes on the bottom.
But This is the Cybex, so it goes twice as deep as the Star Trek you're used to, and it's a 45-degree angle, not the 35-degree angle, so it's much steeper than the Star Trek. That's why this is the best hack squat.
I like this hack squat. They have it at the Troy Powerhouse, I think.
Maybe.
I don't know, but I would probably like this one more because I could do less weight. Because the hack squat at Vinny's gym is killing me.
Yeah. Remember I was doing like 7 plays?
I'm up to 6.5.
Yeah.
And I'm like, this is not good for my spine.
No.
It's not good for anything.
So that's that.
Job well done.
Yes.
High five.